Hi guys. So I haven't done an EDS update in almost 2 weeks. It's because I haven't been feeling well. And then 2 days ago, I injured my arm right here. I cannot bend it. So what ended up happening is um, I woke up and I was completely numb on my right side. I immediately got scared that I had had a stroke in my sleep. So I went through the checklist. I made sure that I could stick out my tongue and it went out equally. Double checked my pupils, double checked my facial expressions by smiling and everything else. And then I tried to get out of bed. Um, so I obviously have like a pillow next to me so I don't fall out of bed. So I rolled towards the wall here and my arm went underneath of me. And I didn't think much of it at the time until I heard the cracking noise that happened next. My arm made a right angle, which, was normal like this and was under me, and I slid to get off the bed, and the crack noise was actually heard by my fiance, who's going to be my husband next month, in the next room. I had not heard a crack noise like that before, and it was then that I knew something was wrong. I got up and my arm was just dangling. And at first I thought I dislocated my shoulder, so I double checked my shoulder. My shoulder was intact, and then the pain started, and it was excruciating. It still is excruciating, but I have to keep it propped up. I started to lose feeling in my fingers. I hollered for Jesse to come into the room, and he came into the room, and we thought maybe I dislocated my elbow. He didn't touch it because it hurt too much to even touch my hand. So I called my family doctor. I called my rheumatologist, and I said that something was wrong. Nobody had called me back in 3 hours. I had taken some naproxen trying to deal with the pain, and it did not work. I took 600 milligrams. Nothing. So then I went to the ER. They checked me out. They told me they weren't going to give me an IV because they didn't think I needed fluids. So I then got a shot in my upper arm on my left side of morphine, and I had a Zofran pill to make sure that I wouldn't vomit. The x-rays came back clear, and the doctor came to me and said, if you did not have such a good pulse, we would take you back for emergency surgery now. Unfortunately, I had a somewhat of a decent pulse in my hand. So they discharged me and told me to go see an orthopedic surgeon as soon as possible. I was just too out of it with the morphine to do anything that night. So I went to sleep. I woke up in the middle of the night, crying hysterically because of my arm. And then the next day, my family doctor called me and said, we need to see you today. It's bad. I then went to my family doctor's appointment, which was at 3:45. I got there around 2:30 is when I walked in. The doctor looked at my arm. She checked it out. most painful having to have it get manipulated by them. Then they said I needed to go for a test immediately. They were calling the hospital and having me get taken in. I still have my bracelets from there. And yeah, I got flagged as a fall risk because the pain was so bad I would start to pass out. I got taken back for them to check my blood flow. So from my neck here, all the way down into my arm and to my hand, they were checking for a blood clot because my hand was swollen. It's still swollen. I can't wear my finger braces on it. And I can't really make a fist or anything like that because of the swelling. We were at the hospital last night until almost 6 o'clock at night, maybe 7. And they did the ultrasound, which I literally broke down in the ultrasound room when they got to my elbow and had to touch it. I started crying. My teeth started chattering because I have when I have severe nerve pain, my teeth start to chatter. It took the lady a good 15-20 minutes to calm me down, or thereabouts, because I was in so much pain. I couldn't take it. I almost passed out. And then she ran through the rest of the tests, and she told me that if something was found, that she was going to send me to the ER for surgery. Thankfully, nothing was found, but I still have to figure out what's going on because my family doctor wants me to just take ibuprofen 600 milligrams every 6 hours for the next 2 days to try and deal with the pain, and it's not doing anything. I'm usually on morphine for pain because of my allergy to codeine. So it's very strange to not be on some form of morphine, whether it be the tramadol or the shot in the hospital, nothing. I have to lay here with my arm kind of propped up. I can't get it to be at a right angle at all. I can't get it to bend past 20 degrees in. It falls backwards and hyperextends, which really, really hurts, so I have to have it propped up to keep it from hyperextending. And I'm now waiting to get the phone number for the surgeon and to call and see when I can get an appointment in. The thing that makes it really tough right now is, so far I am on I've first saw the ER doctor, then I saw my family doctor, then I saw an x-ray technician, then I got the call back from my family doctor saying that I did not have a blood clot. And now I have to go see another doctor. My orthopedic doctor, who I generally have, is a non-surgical one. I'm not going to be calling him. I'm going to be calling somebody else in the same practice. And the thing that gets me is that they said it was bad, but yet they couldn't get me into somebody last night to get this taken care of. So it's kind of scary because from what the ER doctor said is that I snapped a tendon, and I don't exactly know all that much about the stuff with the elbow because I'm used to hearing tendons and ligaments being referred to in my knee because I've had so much problem with my knee. With this elbow, I've had problems since December trying to get a brace for it because it was bothering me and constantly clicking. The one time I counted, it was over 150 clicks in a day. I stopped counting after that because I just got so overwhelmed by what was going on with it and realizing that maybe something was wrong. The last time I had some type of catalyst event like this was when I lost my ability to walk. So I'm rather frightened that I'm going to lose the ability to use my right arm because I am right-handed. And it's very difficult to not do things with that arm. This is the arm that I had in the sling earlier in February because of the snow causing muscle pain in my shoulder. In my shoulder right now and my upper arm, I feel like I have a softball-sized lump that is in the muscle that's just pure pain. And then in the interior of my elbow, right here's the other one. It'd be towards the outside. Jesse, can you point with your finger in more? Right there is where the pain starts, and then it goes out and then down into my arm right there. And if I move my thumb on my hand that's injured, it hurts. Or if I rotate my wrist like this and the thumb has to rotate those muscles, it hurts. So that's where I'm at right now. I'm trying to work through this. It's very difficult to do. I'm trying to deal with it and get the things done with the doctors that I need to. It's just rather hard that I have to go through all of these channels, not seeing just the ER doctor, but my family doctor, going through an x-ray tech, and then going to go see the surgeon. And in the meantime, I have to call back to the hospital to get the report and the x-ray from the ER trip, get the report and the stuff from the ultrasound as well, get copies of those with the reports, and then sign for them at the hospital, and then go to the surgeon or orthopedic doctor or whatever it is that I may need. So it's just becoming very tiresome to go through all that. So far, I've been to the other side of town where the hospital's at twice, and then had to stay there for almost 6 hours yesterday to go to the family doctor, then to the hospital, and then home. So I've been very stressed and very tired and very much in pain. I can't sleep at night because of the pain. I wake up in like intermittent times where sometimes I'll wake up and I've gotten an hour and a half of sleep. Sometimes I'll get 2 hours of sleep. We've been putting ice packs on there to numb the area basically. So I've been numbing it to the point where, my whole entire arm is cold to try and stop the pain, and that barely takes the edge off of it. I can't move my hand. I can't stretch my fingers because it hurts. So it's very difficult. So I will definitely let you all know what's going on with me, and I will put it up on YouTube so that other people who are going through a catalyst event like this can see that, yes, when you're on state insurance, it does take time. Yes, you have to see all these different doctors to line things up to get stuff done. And yes, it's rather annoying and painful, and it's a struggle. So hopefully today I will be calling a surgeon to find out what it is that they need from the reports and see who I need to see and how I'm going to get there. So thank you guys, and I hope you guys are doing well, and I hope that if you do have EDS, otherwise known as Ehlers-Danlos syndrome, that you understand that you're not alone. There is other people going through stuff at the same time, and that you might be lucky like me, and I got to meet my first ever other ehlers-danlos patient when I was in the ER. She was a nurse, and she only had ehlers-danlos hypermobility like me, but she only had it in the lower half of her body. So every one of us is different, every one of us is unique, and everybody's struggle is different. Thanks, guys, and I hope that you guys send prayers and good energy, whatever it is that you like to do, and I hope you guys have a good day. Bye.